Florida Republican Governor Rick Scott announced his support this week for expanding Medicaid, making Florida only, yes, I lost my breath because it was so shocking, making Florida only the 7th state with a Republican governor to opt into the expansion.
While the federal government is committed to paying 100% of the cost, I cannot in good conscience deny Floridians that needed access to health care. We will support a 3-year expansion of our Medicaid program under the new health care law, as long as the federal government meets their commitment to pay 100% of the cost during that time.
Scott's announcement, as seen there in that hostage video, is in many ways a shocking development because Rick Scott, who once led the country's largest for-profit hospital chain, has been one of the, if not the most vocal opponent of the Affordable Care Act, including the Medicaid expansion. He spent millions of dollars of his own money out of nowhere to fight the Affordable Care Act before running for governor, and Florida led the 26 states that fought the Affordable Care Act all the way to the Supreme Court, only to lose. In June, Scott responded to the court's decision upholding the ACA.
It was so disappointing. This is going to be devastating for patients, devastating for taxpayers. It's going to be the biggest job killer ever. We're not going to implement Obamacare in Florida. We're not going to expand Medicaid because we're going to do the right thing.
The practical and moral victory of the Affordable Care Act was that it would provide coverage to an estimated additional 30 million people, around 12 million of whom would get covered through the Medicaid expansion. Rick Scott aside, 14 Republican governors to date have said they will not participate, putting millions of lives on the line. The Urban Institute, an economic and social policy research organization, estimates the Medicaid expansion would provide coverage to almost 6 million people in just those 14 states that have opted out. The implementation of Medicaid expansion at the state level is now the front line of the health care battle in this country, will ultimately determine whether the new clauses in the social contract uniformly apply across the country. Joining us now are Valerie Arkush, former president of the National Physicians Alliance, professor at Perelman School of Medicine at the University of Pennsylvania, friend of the show Avik Roy, former member of Mitt Romney's Healthcare Policy Advisory Group, a senior fellow at the Manhattan Institute, author of The Apothecary, the Forbes blog on healthcare and entitlement reform, Tia Mitchell, staff writer at Tampa Bay Time, Miami Herald Tallahassee Bureau, and MSNBC contributor Joy Reid, managing editor at our sister website, thegreat.com. Great to have you all here. Tia, you broke this story. What changed? I mean, flip-flop is a term that gets overused in politics, but this is a flip-flop.
This is, and what happened is Governor Rick Scott took the practical, the word you used, practical, he said, it just doesn't make sense for Florida to leave 100% federal match on the table.
But the weird thing about it is, like, it seemed like he just that was in the bill back in June when he said it was terrible. It wasn't like he was just rooting around through his desk and saw, oh, they're going to cover 100%. Maybe we should get on this. Like, he knew that.
And it's a couple of points I want to make. Number one, he is not saying Florida will, Florida should.
Right.
He's being very careful to say, if the legislature does this, this is what I would sign.
Right.
And that's an important distinction because he's kind of getting the best of both worlds. He gets to look pragmatic and you know that he's moderating himself. He is running for re-election in about a year. However, he's not saying he's going to advocate for this or that it's even going to make it more likely that it actually happens in Florida.
That's a really good point. What do you think changed his mind on the politics of it? I mean, he like I said, it can't be the fact that the 100% of the costs can be picked up by the federal government. He knew that to begin with.
I think moderating himself for re-election is a factor. Also, he pointed out his mother passed away in November. He said it gave him, quote unquote, new perspective about, you know, the law and its impacts and the needs of families to have health care. So, I mean, I do think some of it was a personal decision, but it's also political, and it's also, you know, the bottom line is money.
With those federal dollars being available, and for 3 years fully, and at 90% for the following term, you know, we believe that, you know, that's just too much money on the table. It's $26 billion over 10 years, $7 billion in the first 3 years, Floridians to pass up.
That's, like I said, Mark Robertot, incoming president of the Florida Hospital Association, testifying before the Florida State House on this Medicaid expansion, which the government pays the first 100% of the expansion for the first 3 years, and it ultimately goes out 90%. Avik, as a Republican health policy wonk, did Rick Scott do the right thing?
Well, you know, one of the things that we talk a lot about in health policy circles is coverage. We're expanding coverage. We're doing this with coverage. There's a lot less emphasis on the quality of coverage. And this is the real problem with Medicaid. So in Florida, for example, for every dollar that a private insurer pays a physician to care for a patient, Medicaid pays 44 cents.
Right.
And what this means is that a lot of doctors don't take Medicaid because they lose a lot of money caring for Medicaid patients. And so you have a card that says you have health insurance, but if you can't get access to a doctor, your cancer doesn't get diagnosed early. It gets diagnosed late when it's too late to treat. Your heart conditions don't get diagnosed early. They get diagnosed late when it's too late to treat. And so the health outcomes for people on Medicaid are much poorer than they are for people on private insurance.
But they're better, but it depends on what the control group is, right? Because they're much better than people that don't have health insurance.
Not necessarily. So there have been a lot of studies that have shown otherwise. So the University of Virginia conducted a study looking at 900,000 surgical patients that showed that actually Medicaid patients had higher in-hospital mortality than people with no insurance at all, even if you controlled for age, income, prior health status.
My sense of the literature is that actually Medicaid actually has relatively good health outcomes, and it depends on the control group. I mean, there's been a lot of different studies.
There's certainly a lot of debate about it, but I think nobody debates that Medicaid is a lot worse than private insurance. And so I think one of the tragedies here is there was an option for states, it depends on the state, to put more people on the exchanges where the quality of coverage would have been better than the Medicaid expansion where the quality of coverage is worse. And I understand the hospitals are grabbing the money, but in terms of the patients, it's not obvious that the patients are going to do better.
So I think that when we see in real time watching what Medicaid does for people, it makes a tremendously positive impact on
we're also going to have a big data set now going forward.
Sure.
I mean, the control group is...
We'll see for sure.
Right.
But I mean, the Oregon study has not yet measured actual hard health outcomes. It's only measured subjective self-reporting.
And also to your point, though, about private insurance, Florida is moving towards managed care in Medicaid, so it will be privatized. There will be, HMOs and insurers who are controlling the Medicaid program in Florida. And also, Florida right now is opting out of an exchange. So it's interesting some of the points you make.
Right. I mean,
Florida.
But that's not the same thing. So Medicaid managed care, they're still paying at the reimbursement below reimbursement rates, whereas the exchange will have higher reimbursement rates. So the access to physicians, the access to quality care will be better.
The Republican-led legislature in Florida has some of the same concerns, I think, and especially the Florida House, which is more conservative. And I talked to several members last week, and they said, we just don't believe the federal government's going to make good on its promises. This is deficit spending, so there are definitely, conservative, talking points as to why the Medicaid expansion doesn't make sense. But the other side is, you have in Florida millions of uninsured, and this would reduce it, give 1 million people insurance. So there's just kind of those two sides that have to be debated out during the session.
In that clip that you broadcast with Jack, Jack Liu, he's right about the incentive. States have this incentive to take the money because otherwise it goes to taxpayers and other states with other states. But the difference is between now and then. Why is this more of an issue now versus say 1965 or 1997? Is that Medicaid is now such a large part of state budgets that they're much more sensitive to the issue of are they going to be on the hook for this extra Medicaid spending down the road if the match declines. So it's 100% for the first couple of years. It's 90% at the end. What if it goes to 85? What if it goes to 80? That's what state governments are worried about.
Well, the sort of potential presidential candidates, Wisconsin, Scott Walker's not taking it. Louisiana, Bobby Jindal's not taking it. South Carolina, Nikki Haley. The people who seem to have national political ambitions seem to be not taking. I feel like it's more of a political calculation.
We should say Wisconsin's a weird case, though, because they were already covering up to 200% of the federal poverty line.
Right.
So they're actually in a weird position because they already had eligibility above the.
Right.
So it's a less devastating impact in Wisconsin in terms of who's not going to be covered.
And I really love what Scott Walker did in Wisconsin because he understood the point that I was making before, which is that the exchanges will provide better coverage than Medicaid will. So the way he set up his system was to maximize the degree to which people will be on the exchange.
But this is the thing that drives me crazy about the Republican approach to Affordable Care Act, which often looks like trolling to me, which is basically to say, well, the exchanges are going to be better. None of the Republicans are setting up the exchanges in their states. We just hit the deadline, and basically everyone said, you know what, I'm not going to appropriate any money. I'm not going to get them working. Exchanges are incredibly logistically complicated. If people really think that the exchanges are going to provide the highest quality health care, then why won't they get their S together to get the exchanges going?
They don't need to, because the federal government will run them anyway, and the states actually have very little latitude to change or design the exchanges in a different way than the federal government will. So it's easier for them to offload that risk onto the federal government, because if there's anything that goes wrong with the implementation of
they don't want to be.
Sebelius gets blamed, Obama gets blamed, not them.
No, that's a political calculation as well.
But people will still get covered.
Republicans didn't believe in federal control of people's lives. Now they're basically saying, hey, federal government, come in and run the exchange in my state. This is completely upside down.
Well, no, as I said, because they don't have much latitude. So if the state really did have a lot of latitude to design the exchanges in a way that they wanted or they saw fit, then that would be different. But
Sebelius, they tried to work with them. They said, listen, we will work with you.
Everybody got a waiver that they wanted.
From a policy standpoint, the latitude that states have to design the exchanges or structure them in a different way is very, very small.
Arkush of the National Physicians Alliance, Tia Mitchell of the Tampa Bay Times, and MSNBC contributor Joy Reid. Thanks for being here. That's fantastic.